MOU with AIIMS Bhopal, in which you can get yourself digitally registered. Then we have started giving AIIMS Bhopal Swasth app, which is an award-winning application on the mobile. I will come for a screenshot. If a patient is coming second time, third time into the hospital and he wishes to do a particular OPD, he need not to go through the entire drill. He can go to that particular OPD, there is a QR code. If he has a smartphone, he just scan it and he is registered. And I will come to another thing, people may not have a smartphone in a country like ours. So there is also something we are doing it. We will come in a minute for that. Then we have the AIIMS Bhopal dashboard in which we can get real-time census. All our investigations are on the LIS, Laboratory Information System, or Hospital Information System. We have created virtual beds, and this is unfortunately on the right side where the pointer is, it is Hindi, but it says Kataro se bache, which actually means spare yourself from the queue. And I think you might have heard something called Paytm, which is a payment interface, but then this payment interface has also become a way to get yourself digitally registered in a hospital setup. And on the left side, this is our own application devised by the AIIMS Bhopal, in which you can register yourself, you can get the charges known, what are the various charges, you can know when your appointment is, you can get your laboratory reports and so on. So this app is kind of one app solution for most of the things which are required in the hospital. And then we have innovative practices. We have now what we call medical social service officers or medical social workers. Our directors introduced runners. The person who is admitted need not to go to the pharmacy counter to get this thing. There is a runner from the pharmacy side, he will bring your drugs to your bed. Same thing with the investigations part. We have volunteers. When you go to the hospital, I don't know whether because it's late, but you may find security guards are doubling up as a may I help you people. So you can just approach them and ask them where to go, how to go. Then there is involvement of NGOs providing us some kind of services like ambulance or hair salon or some wheelchairs kind of things. Then there are rounds by the MSSOs, nursing staff, which we call action optimization, which are frequently monitored. Then there are administrative rounds and supervision by the various hierarchies. Our entire pharmacy management is now online. A person sitting in a ward can raise the stock, raise the requirement, and also he can see what stock is available in the adjacent department or any of the departments. And then we are moving towards the paperless prescriptions. Now the success story is what data speaks. In 2019, there were only 48 cases were registered in Ayushman Bharat. In 2022, the number leaped to 8,700. In August, we have crossed the numbers of last year Ayushman beneficiaries, and it is far more ahead of the last year numbers, and still 5 months are left. If we see the digital part, so I will take you one by one count. The OPD numbers have increased from January to August, almost 30% increase, 62,000 to 96,000. That is the increase of almost 30% in 6 months. If we see what you are seeing is scan and share, it's an astounding rise, 400 times, 937 to it has reached to 36,000 numbers to scan and share. Yes. The online appointments are also shown a consistent rise, 7,000 to 9,000 numbers now. What you are seeing, digital registration in January was just 14%, now it has reached to 47%. And please do not get fooled that only 50% of the people coming to hospital are digitally registered. This is the number of new patients. And if you add to the old patient, the number is somewhere around close to 70 to 80%. What Government of India wants that everyone should have a Ayushman Bharat ID, health ID. The numbers in January were 5,000, which has reached to August and 17,150. Means it is almost 3 times jump in number of ABHA ID creation. In this year, we have already created 1,35,137 ABHA IDs. So this is a brief about what digital part is, and we will be taking you to the hospital. Thank you very much for listening. If you have any questions, please feel free to ask.
Thank you, Dr. Shashank. Because we are running short of time, we will move on to the next presentation. presentation. And the next presentation is the rarest of rare combination. We have in the next speaker someone who embodies both a doctor and an engineer. He is the